Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to Redefining Medicine. I'm Melissa Ferguson, and I'm so pleased to introduce you to Dr. Austin Perlmutter today. He's a board-certified internal medical physician, a New York Times best-selling author, researcher, and consultant, and his focus is on helping to identify and resolve the biological basis for stuckness in the body and brain, especially when it comes to decision-making. So Dr. Perlmutter, what drew you to the study of medicine and the focus on decision-making in particular?
Well, I've always had kind of two passions. One was science and the other being helping people. And luckily, there is a field in medicine that enables me to combine both of those. I decided to focus my efforts in medicine in internal medicine because I am also just very fascinated with the pathophysiology, what goes wrong that leads to chronic diseases, the top killers of people and top contributors to disability around the world. What I realized over the course of many years in medicine is that we focus so much on the what of prevention and too little on the how. We give information, we assume it will be acted on. We know we can prevent diseases if we simply have healthier actions, but we don't act. So generally, and especially in medicine, we miss this really key subject, which is how do we optimize brain function to enhance the quality of our decision-making? And again, I think this is a huge miss. Neuroscience has clearly shown that our decision-making is a reflection of our brain structure and function. And this is something that we can both measure and optimize through certain drugs, but especially through lifestyle modification. This was a major subject of the book I wrote with my father, Brainwash, which came out last year.
So you will be speaking at the upcoming 29th Annual A4M World Congress. Will you provide us with a preview of this topic, please?
So I've had the privilege of getting to speak at many conferences on a variety of subjects, most of them digital in the last couple of years, but I have to say this is one that I am so excited about doing. As many people know, we live in a time where hundreds of millions of people around the world are struggling with their mental health, and of that, a large percentage are dealing with depression. There are many more people who don't quite meet criteria for depression, but still have significant depressive symptoms. And research shows that this has only worsened in the last few years. And while things like conventional antidepressants do help many people, they're far from a panacea. So a couple of things have happened in the last couple of decades of depression research that are really worth knowing about. First, we've moved away from the idea that depression is caused by a deficiency in neurotransmitters on its own. So it's not just a serotonin issue. For example, we now know that the immune system and that inflammation play a role in our mental health and may lead to and promote certain cases of depression. It's also now been shown that neuroplasticity, which is the brain's ability to rewire itself in response to new information, may be both affected in and contribute to depression as well. The other big thing is that we're now exploring new therapeutics that have been shown to provide significant benefits to people, especially with tough to treat depression. And a good example of this would be ketamine. Unlike conventional antidepressants, ketamine doesn't take weeks to take effect. It can start working within several hours. So that has led researchers to question, how is it that a drug like ketamine might work? If it happens so quickly that people get this effect, it maybe isn't through the serotonin mechanisms that we're so familiar with. And that has led us to the subject of neuroplasticity, because it's thought that ketamine, as well as other psychedelics, appear to act through the neuroplasticity mechanisms, changing the brain wiring and function and leading to antidepressant effects on the scale of hours, as opposed to, again, weeks. So in this conversation, in my upcoming presentation, we're going to be talking about clinical trials that look at the efficacy of psychedelics on mental health conditions. We'll explore some of the relevant history of psychedelics over the last several decades, and we'll specifically be looking at how psychedelics play into this conversation about this neuroplasticity mechanism as it relates to depression.
So how did you become involved in the research surrounding this topic? And also, what have been the most impactful things you've learned since?
One of the things that has been so consistent for me in my learning, both in medicine and just in life, is that mental health has to come first. That when we look at other things, they're largely surrogates. And yet, when I think about how we approach mental health in medicine, as well as just generally, we tend to have relatively limited treatment options. And in the medical field, it's the unfortunate scenario that many providers are actually experiencing worse mental health than the average person. I've personally dealt with depressive symptoms in the past, and I realize we have a long ways to go in coming up with ways of talking about, managing, and ideally preventing conditions like depression. So that has led me to have a personal interest in depression. And I have spent many years studying the medical literature as it relates to depression. Something that has come up in that work and that we can increasingly see discussed even in the layperson space is that psychedelics appear to have potent antidepressant effects when they are given to the right populations in the right set and setting. And beyond just the effects on mood, psychedelics appear to change our thoughts. And they appear to change our thoughts for a good amount of time. It's not a transient effect. They also influence our ability to connect with other people. They influence our connection with nature. So there's something going on more than just some simple changes and the types of things that maybe we would expect to see with conventional antidepressants. So this leads to the fascinating work that is being done connecting depression with neuroplasticity, the changes that occur in our brain as a result of new information coming in. And researchers think that the neuroplastic mechanisms, these changes that occur in our brains, may be one of the ways in which psychedelics can lead to these effects within depression. So it's really a fascinating convergence of various areas of research that have led us to being able to have this conversation today. There's research in neuroplasticity and depression that shows that changes in the brain tend to be more prominent in people with depression, that people with depression tend to have lower levels of brain-derived neurotrophic factor, which is a key molecule involved in neuroplasticity, and that psychedelics may act on some of these things. There's even literature showing that psychedelics may increase levels of BDNF immediately after people take them. So there's lots of connection here. And I am so interested to see where the literature goes on this in the coming years. But right now, there is a fascinating conversation occurring that I can't wait to bring you into.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
So we also see that you've published research earlier this year on the immunological intersections between COVID-19 and depression. How did you conduct the research and what were your key takeaways?
So I published a review paper in Frontiers in Neurology in April of this year. And the purpose of this paper was to basically look at the ways in which there are overlaps between the immune system, depression, and COVID. The idea behind this is that COVID is obviously a big deal for a variety of reasons. But one of the connections that has been so prevalent with COVID and a variety of kind of the negative outcomes relates to how it influences our immune function. So We saw early on that something called the cytokine storm was a risk factor for people having worse times from COVID, meaning more severe outcomes from COVID. The body tends to engage in an acute inflammatory response as a result of being infected. Why that's important is when you look at depression and you understand that depression has a strong link with inflammation, where inflammation seems to promote the development of depression, you can start to see how there may be a connection between getting the infection, having an immune response, having elevated inflammation, and subsequent development of depression. And a number of studies have shown that there is a higher rate of depressive symptoms and other neurological symptoms in people who have had COVID. But the other really important point to make here, and maybe the piece that people tend to miss, is that the immune changes that have happened as a result of the pandemic far exceed what has happened as a result of infection. When we understand that our lifestyle factors, the food we eat, the exercise we do or do not get, the stress we experience, the sleep we get, that these influence the immune system. And then when we look at how these variables have changed over the course of the last few years, usually for the worse, people tend to be eating more processed food, not getting as much high quality sleep, not exercising as much, and experiencing a whole lot of psychological stress. That leads to an overall inflammatory state. So if inflammation ties to depression, and we are doing things, making choices that induce inflammation in our bodies, we might expect to see higher rates of immune-mediated, inflammation-mediated depression. And in fact, what we are seeing across the planet is higher rates of depression, not just in people who have had COVID, but in people who have been under lockdown, in people who are caregivers for people with COVID, in the general population. The point to all of this isn't just to say, well, this is a bad thing, and therefore we should be more concerned, but instead to think about the fact that if we can negatively modulate our immune status, meaning increase inflammation because we don't eat good food or don't get good exercise, then the opposite should be and actually is the case as well. It may be the case that the reason why getting some exercise may be preventive in depression or eating a Mediterranean pattern diet may help treat symptoms of depression is because it works on the immune system. So to tie all of this together, what it means is just we need to be thinking about connections beyond just the immune system is fighting off microbes and I do or don't want to get an infection. That really the immune system is a central broker of inflammation. Is a central broker of information. And that through this inflammatory pathway, we may both have more insight as to what is inducing depression and how we can manage it.
Thank you so much for all of your insight today, Dr. Perlmutter.